It's a Northwest Lifestyle Weekend on KOMO News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, let's get things underway. Dr. Reshma Desai, an internal medicine physician from the Polyclinic. Pre-diabetes, something to be concerned about, and there are ways to prevent it.
Absolutely, Tom. This is all based on weight, diet, exercise, et cetera, all preventable things and activities that we can do to prevent prediabetes.
Dr. Reshma Desai and Shannon O'Kelly.
Dr. Desai, welcome. How are you doing?
I'm good. How are you?
I'm doing great. Welcome to Health Talk. We're going to talk about prediabetes and diabetes, but tell us about your practice. You're at the Polyclinic. You're an internal medicine physician. So give us an understanding of your practice, the day in the life, right?
So I work at Polyclinic and I practice internal medicine. So I usually take care of adults that are 18 years and up, focus on their overall well-being, both physical and mental.
So prediabetes or diabetes, let's talk about that. We hear it, see it, it's in the media a lot. We know it exists out there. We talk about type 1, type 2, but maybe tell our listeners from a physiological standpoint, what is diabetes? What's going on in your body, or what's maybe not going on in your body?
Right. So diabetes and prediabetes are basically concerned for higher than normal blood sugar. And there's different ranges that would predispose you to being pre-diabetic versus diabetic.
Okay, so when you talk about blood sugar, the way the body works, maybe you can describe the hormone insulin and why it's needed and what it does in our body to decrease sugar in our blood, basically.
Right. And so basically sometimes when we have excess fat in our body, there's a hormone called insulin that's made by the pancreas. And our body, it's not able to use the insulin well enough to control our blood sugars.
So when your blood sugars elevate in your bloodstream, your body triggers insulin to be released, and the insulin is then pushing the sugars to be stored and get the sugars out of the blood system.
Right, exactly.
And why is high sugar level bad in the blood system?
So, and that is pretty much the definition of diabetes, and the reason it's bad is because it can cause several types of symptoms, such as blurry vision, fatigue. It can cause increased urination, increased thirst, and these are all alarming as it can lead to even more severe symptoms or organ damage down the line.
Yeah, I've heard it described like when the blood becomes thick, and because sugar is thick and syrupy, and when it gets too much sugar and the blood thickens, and that's bad for these capillary beds, and it's really bad for circulation, and that's why majority of problems with diabetes is really stems from circulation. Is
right.
That accurate to say?
Yeah, that's definitely part of it. And our worry is that there's concern for damage to your kidneys, to your nervous system, and even to your eyes, your vision. So it can really affect your whole body.
And as an internal medicine doctor, you probably see this frequently in your practice because it's out there more than I think we realize, particularly the type 2 diabetes. But before we get to type 2, let's talk about type 1 versus type 2.
Right. So type 1 typically is you're born with it. It's you're genetically predisposed to it, but you're also just born with it. So you're typically going straight to insulin once it's diagnosed.
And type 2 is sometimes it's referred as late onset or juvenile onset. Something's going on here with type 2 based on your body composition.
Right. Type 2 is typically related to sometimes lifestyle factors. Poor diet or sedentary lifestyle can lead to risk for developing type 2 diabetes. But there's also a family component. So if you have a family history of diabetes, you might be predisposed to developing diabetes as well.
So in type 2, if your lifestyle changes or is not good, maybe you're eating too much processed food, too much sugary foods, maybe you've gained some weight, not exercising. Is it fair to say the body just gets worn out and can't produce enough insulin to get all that sugary substance out of your blood? How would you describe type 2?
Yeah, type 2, I would say it kind of goes back to the insulin resistance. And so our body is not able to control our blood sugars because of that insulin resistance. And so that can develop over time with those lifestyle modifications or factors, I should say, like being overweight with the excess fat that makes your body less resistant to insulin.
Are you seeing in your practice type 2 is on the rise in your practice and with your patients?
I would say it varies with the population, but definitely it's something that we're more concerned about these days with all the food that's available. It's all about modification and making sure you're well balanced with your diet.
That's Dr. Reshma Desai, internal medicine physician from the Polyclinic. We're talking about pre-diabetes, and if you'd like to get more information on what Dr. Desai does, you can go to polyclinic.com. Shannon's conversation with Dr. Reshma Desai will continue, and coming up later in the day, Dr. Mikhail Burakovsky talking about diabetic neuropathy. It's all coming up as we continue right here on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. IRG's Health Talk continues.
Here's more with Dr. Reshma Desai and Shannon O'Kelly on KOMO.
Dr. Desai, again, thank you so much for joining us, and thank you for the great information you provided us regarding diabetes and prediabetes, type 1 versus type 2. But I'm interested to find out, how would I know I have diabetes?
So the best way to find out is to get an accurate diagnosis by your doctor, and there's blood tests that can be done. And the first one I would suggest is a hemoglobin A1C, and it's an average of your blood sugar over the last 90 days. So that will really get us an idea of where your blood sugar stands. The other thing you can do is get a fasting blood sugar, and that's typically done in the morning, and you don't want to have eaten 8 hours prior to getting that done. But it's a snapshot. It's telling us exactly what you where your blood sugar is at that day. So it's not necessarily the one test that you want. You might want both of them just for an accurate diagnosis.
Do you have a preferred choice in your practice?
I definitely like getting the hemoglobin A1C, as it's more of a bigger picture rather than the fasting blood sugar.
And besides, getting the test and get a definitive diagnosis through a blood test, let's say I'm one of these people, I'm not going to name any names, that doesn't go in for my annual physical, right? Okay? And no names here, right? and so if I'm not getting a blood test on a yearly basis, would I have any symptoms? I mean, what would be my symptoms if I'm diabetic?
Yeah, that's a great question, actually, because I urge everyone to go in to see their primary care doctor, even if they're feeling perfectly well, at least once a year, because prediabetes does not necessarily have symptoms. And what happens is once you start going into the diabetic zone, you can start developing fatigue, blurry vision, increased thirst, or increased urination. But with prediabetes, you may not know without doing the blood work. So definitely visit with your primary care doctor at least once a year, just for these routine tests.
And prediabetes sometimes is just, the treatment is maybe just changing habits, changing lifestyle, increasing exercise, and you can stop prediabetes or slow it down. Is that accurate again?
Definitely accurate. It is reversible, so it's the best way to address it would be your lifestyle modifications. Diabetes does require medications, and most people are very averse to medications. So if you're diagnosed with prediabetes, that's the best thing to do is start focusing on your health, focus on your level of activity. You can cut out things like red meats or at least limit your red meat intake, as well as sugary beverages. Start incorporating fruits and nuts and vegetables. Work on at least 150 minutes of activity per week, aerobic or cardiovascular activity.
Is there any thing a patient should know, the cardinal sign that you might see without getting your blood test done, that you should have it checked or followed up? I mean, you talked about increased urination, increased thirst. I've often heard sometimes they have a smell, sometimes on their breath if they're diabetic, kind of a ketosis. I don't know if that's still out there or not. Yeah,
and that would actually indicate you're getting pretty severe, so I definitely would say you might already be having some of those symptoms that we talked about before already. So, but the one thing is also, if you've just noticed you're starting to gain more weight or your lifestyle has changed, you might just want to go and get checked to make sure that you're not heading in that direction.
Okay, that is great information. Once again, thank you for your time. Excellent job. And good luck in your practice up at the Polyclinic.
Thank you so much.
That was Dr. Reshma Desai, internal medical physician from the Polyclinic, polyclinic.com to get more information. Pre-diabetes, Shannon, diabetes has been around for a long time. We're learning more about it, more ways to treat it, but pre-diabetes gives people the opportunity to perhaps prevent it altogether.
Yeah, it's exercise, it's lifestyle changes, as she was talking about. Diabetes comes in two forms. Type 1, which is the genetic. Type 2 is lifestyle.
All right, thanks to Dr. Desai again. Dr. Mikhail Burakovsky coming up next on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest, Dr. Mikhail Burakovsky, podiatrist from the Integrative Foot and Ankle Centers of Washington. We talked about prediabetes with Dr. Desai, and we're talking about diabetic neuropathy with Dr. Burakovsky. What does that entail?
Well, part of the sequelas or the results of diabetes is neuropathies. I mean, these are neurological dysfunctions and deficits based on having diabetes.
All right, here is Shannon O'Kelly and Dr. Burakovsky on KOMO.
Well, Dr. Burakovsky, welcome back. How are you doing today?
I'm doing great. I'm excited.
Springtime, summer's right around the corner. People are going to start moving. We're going to talk about diabetic neuropathy. Because diabetes, that disease, can affect a lot of our systems and organs and body parts, in particular circulation. And you being a foot doctor, tell us about diabetic neuropathy in the feet particularly.
Diabetic neuropathy is basically a disease of a nerve. Now, neuropathy on its own does not have to be diabetic. We see all kinds of neuropathy related to chemotherapy, some medication, trauma, injuries, but diabetic neuropathy is the most common one that we see in our clinic.
Well, tell me what's going on in diabetic neuropathy. The diabetes causes some systems to fail or some circulation to be impaired, and tell us what's going on with diabetic neuropathy.
Well, let's talk about neuropathy and what it is basically. In the simple words, if you think of a nerve, we kind of compare it to a wire, we compare it to a cable, and when that cable loses insulation, when the cable loses connectivity, that's when we have a problem. Same thing going on with the diabetic neuropathy. It could be, loosening of that insulation due to increased blood sugar. It could be due to the lack of oxygen coming to the nerve. But once you lose that insulation, you lose the speed of nerve conduction, you lose the sensation, you start getting pain along your limbs, and then it progresses.
Well, with nerves, and we know how sensitive nerves are. I mean, nerve symptoms can range, I think you just said it, from a multitude of different symptoms. You can lose sensation, you can have numbness and tingling, you can lose what we call proprioception. I mean, you can have shooting pains. There can be a variety of symptoms, can't there?
That's correct. And the interesting thing is that a lot of the times we don't feel it. It kind of sneaks on us silently. It starts as a numbness, and then it progresses in this tingling, burning sensation. And sometimes people describe it, they have like sand in their shoes, but it doesn't stop there. It progresses into the muscle weakness, and it could actually affect our organs. It could affect our joints, can cause fractures in our feet, and people can die from it.
And when you talk about the feet, we particularly talk about, a lot of times with neuropathies, we talk about peripheral neuropathies. I mean, so maybe talk about peripheral neuropathy, because that's the neuropathy of the extremities, and particularly the feet and hands.
Well, what happens with the peripheral neuropathy, because it does affect our extremity, we lose sensation. Once we lose the sensation, important functions are affected, like balance, like sensation that normally, let's say if we step on something, we feel normally pain. If we don't, and we have a little rock or needle stuck in our shoe, that causes an open wound, and that progresses into infection, and then possibly hospitalization, and you could even lose your foot or leg resulted to that.
Now, in your experience with diabetes and people that have, this is typically diabetes or diabetic type 1. These are those patients. Is that right?
It's both type 2 and type 1.
Okay, that's good to know. Do you mostly see it in type 1 or type 2? Is there an even kind of play field there?
I would say type 2 more, and I think we see more type 2 diabetics than type 1.
Okay, and the type 2 diabetics are the diabetics. This is an adult onset. This is usually related to maybe obesity, weight gain, different things going on here.
Correct. So, it's a sedentary lifestyle. It is the obesity. It's effect of our nutrition.
So in diabetes, from a physiological standpoint, tell us what's going on in circulation if you can.
So basically, once we have a decrease in our circulation, and we know that increase of blood sugar could affect our blood vessels, could cause calcification of blood vessels and decrease of oxygen supply. And that could actually cause the death of a nerve. And, as a good example, if we're not getting enough oxygen to a muscle, we get pain. And that's related to lack of oxygen to a nerve as well.
More of our conversation with Dr. Mikhail Burakovsky and Shannon O'Kelly coming up after this time out on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
Time to begin our second segment with Dr. Mikhail Burakovsky. from Integrative Foot and Ankle Centers of Washington and Shannon O'Kelly.
So we're talking about diabetic neuropathy, and you have described it really well. And from a physiological standpoint, what's going on with circulation, signs and symptoms. We know that either type 1, type 2 diabetics can experience the diabetic neuropathy. How do you diagnose it and treat it?
Well, there are several ways to diagnose it, and there is clinical ways where we actually check the proprioception, and we use the special monofilament to check how the nerves are sensitive to the pressure. But there are more gold standard tests, and one of those that we do, it's called nerve fiber biopsy. That's actually when we take a little tiny sample of epidermis and we send it to a lab, and they look under the microscope, and they're able to tell how bad neuropathy is. That's a great test, not only because it's very accurate, but also by doing this test, we can differentiate neuropathy from radiculopathy. A lot of people that we see come in and they might think they have neuropathy, but no, they have other issues. So numbness does not mean you have peripheral neuropathy.
So doing the biopsy basically confirms the neuropathy based on changes in the nerve tissue and cells.
Correct, but test is useless if you don't combine it with other knowledge. So clinical findings, in combining with the very specific testing, combining with possibly doing an EMG testing to identify the speed of a nerve and to isolate the nerve, that's what really gives us the exact diagnosis.
So once you have this diagnosed, what are your treatment options? I'm sure there's medication, lifestyle changes, nutrition, et cetera, et cetera. What are you recommending?
Correct. So once we have the correct diagnosis, then we take a team approach. Number one, we look at your nutrition status. We look at your blood test. We contact your primary care physician, and we attack the cause of the problem. Then we look at, what kind of shoes you wear, what's your balance, what's your lifestyle, and all that taken in consideration and deciding what's the appropriate treatment for you specifically. It's not a cookie cutter. It's individually picked treatment plan.
So once you've identified pathology and you can treat it, I guess the question is, can you reverse the damage?
So if we cut it early enough, a lot of the times we could reverse it. I've seen it many times in our patients. Now, if it's a chronic, if it's something that's been going on for years, then it's more difficult. But the great news, most likely we can stop it and possibly make it much, much better. And most importantly is to prevent complications of it.
And you mentioned this before, but as a physical therapist, we've seen the results of this in our practices. And this is a situation where a patient with diabetic neuropathy does not have sensation, and you mentioned gets a wound. And that wound, they can't fill it, so then that wound grows and becomes an ulcer. And that's a real problem in diabetes.
Correct. But physical therapist is a very important part of our team. And one of the things what we see with neuropathy is falls, poor balance. And that's where physical therapy really play a huge role, where we can retrain those muscles that get weak, where we can retrain balance and basically return patients to their normal lifestyle.
Wonderful information. Thank you for your time. Diabetic neuropathy is out there, and you just explained it really well, and I'm sure our listeners appreciate that information.
Thank you very much.
That was Dr. Mikhail Burakovsky, podiatrist from Integrative Foot and Ankle Centers of Washington. Go to diabeticneuropathy.com to get more information, and some great information from him today on this whole foot issue. You can also visit him at seattlefootdoctor.com, but good stuff to learn today.
Absolutely, Tom. Neuropathies are tough. I mean, it's best to treat them as soon as you know you can treat them. That's what it's all about. Prevention, wellness, and treatment.
Thanks again to Dr. Burakovsky, and we'll be back with our final segment after this time out on KOMO.